A lot of women may not know that they're at increased risk for cardiac disease later in their lives, really based on symptoms or conditions that they've had earlier in their life. And specifically, what I would really want women of childbearing age to know, or women who've had children in the past, is that if you've had complications in pregnancy, that may be an early sign that you're at elevated risk. So if you've had high blood pressure in pregnancy, diabetes or gestational diabetes around the time of pregnancy, something called preeclampsia or eclampsia, or peripartum cardiomyopathy, if you know what that is, then you know that those are things that have strained the heart at the time that you've been pregnant. So in a time in your life where a lot of women are running around worrying about, what are my kids eating? And did they get their vaccines? And have they been to the pediatrician? And are they healthy? How many of those women are going to the doctor themselves? It's really important that women know their risk factors, and especially if you've had these issues in pregnancy before, prioritize yourself. That's an important thing to do. Who's going to take care of your family if you're not well? You need to have a good primary care doctor. You need to have your blood pressure checked once or twice a year at the minimum. Get your cholesterol checked. Know what your family history is. Cardiac disease tends to affect women later in life, in their 60s, 70s, 80s. Before that decade, you really have an opportunity to be proactive about your health and try and prevent some of the diseases that we see.